Nice. We have Cedric here today. He's a software guy.
Yeah.
Yeah. And what do you want to work on?
Mostly going to be like left side from the neck down to the shoulder and maybe lower back.
Okay, cool.
Yeah.
So let's start on your back. So you'll be face up.
Okay. Head on this side?
No, just right in the middle.
Head.
Yeah, head on this side. You're right.
Yeah.
I wasn't thinking what, I couldn't picture what you were saying. And he's pretty balanced, but when he gets out of balance, we've known each other. I mean, I haven't seen you in a while, but we've worked together. It's not our first time. But he'll get like one side. Like today, it's his right side. And right here is like do you feel that spot?
Yep.
So, and he really knows his body. So he can come in and just say, it's right here, here, and he's spot on accurate. So I'm just going to loosen this up a little bit.
Mm-hmm.
I'm stretching a little bit. I'm going to pull it this way and just stretch and just check range of motion. And you can see I'm digging in, so even though it looks like I'm doing a nice gentle stretch, I have really good leverage to get my thumbs in there. Right there, you feel a little tight spot.
Mm-hmm.
And for him, he's more of a tune-up. I mean, he's not in horrible pain. He doesn't have an injury. He comes in occasionally just to get checked. And, you know, even he said a lot of these spots he can get on his own. But he'll come in sometimes if there's a spot that's getting a little nasty, he might have me work on it.
Yeah, it's the cost of flying coach.
Where did you fly recently?
Seattle.
Yeah. So I guess that's a long flight. Mm-hmm. It's about 5 hours or more.
Yeah, 5, 6.
Yeah. All right. So I'm going to do this side first, okay?
Okay.
Take a breath in first and relax. So it's important for me to get a patient or client to relax, especially someone, he's a lot stronger than me. So if he didn't want me to adjust him, I just can't even get in there. So I have to get him to relax into it. Nice. Big breath in and blow it out. Good, let's switch sides. Nice. Now I'm going to have you lie face down. I'm going to give you a piece of paper to go under your nose.
Okay.
So turn on your belly. Dropped a bunch of papers on the floor. And you feel around this scapula too, right?
Yep.
Do you ever do any Gua Sha, you know, the scraping thing?
You know, it's funny. I was just about to. I've been looking for a graph. It's a Grafton.
Yeah, so Graston.
Yep.
That's exactly what I'm talking about. Let me see if I have mine up here. If not, it's at the desk.
Pop the shirt off? Or?
Yeah, is it okay if we do a little bit? Here,
Yeah.
look. Yep.
That's fine.
Okay.
It's funny. I've been looking for a Grafton guy in New York.
Well, you
I have one. I have somebody in Oregon, but no one here.
So I'm going to mostly just do this kind of shoulder blade here because this is where you were telling me you have a lot of stuff, right?
Mm-hmm.
Yeah. And then,
So you know what makes a red? Is that okay?
Yep.
Okay. I didn't want you to go like, why did you make my shoulder red? So I have a few different shapes, but this one is a good one for this area, for this angle.
Yeah.
And so I'm going to just get a little bit. This is just massage oil, which is real gentle and hypoallergenic. I might have some other goodies in here. Maybe not. I thought I had also some CBD oil. Probably not, but I have the massage, which is fine. Okay, so I'm just going to start working in here, and we're going to bring up some of that circulation. I think I'm going to start with some long strokes because I'm feeling the texture. You can do choppy stuff, but right now I'm just going to start with long strokes because I just want to feel texture and pattern of the muscle. Big breath in, and then blow it out. It's already getting a little red right here. Is this a spot you sometimes feel too? Yeah. It's kind of...
I was going to say that while you were adjusting my neck, I could feel when you turn my head to the right, I could feel right under like the right, we'll say glenohumeral.
Yeah.
And so it's on the lateral side.
Turn your face to the right now.
Okay.
And do you feel it in this area when you do that?
No, that's actually fine.
Okay, back to center. So I'm just going to soften this area up.
Yeah. Right now, only like a 2-3 for pain.
Okay,
No pain.
good. So he was just saying, because his face is down, I'm just going to repeat it. On a scale of 1 to 10, he's just feeling like a 2 or a 3. 10 meaning the most, correct?
Yep.
Okay. We have to have the same reference point, because if 2 or 3 was a high, like the worst number for you, then I wasn't listening. I'm going to change the shape. I'm going to get a different one. This one looks more like a fish. Here, look. Oh, yeah. But I can get this. I can get the angle in better. Big breath in and blow it out. Taking a little bit of the oil away because there's too much. And still working into the same region. Now I'm going to take your arm and put it behind you, and then drop your shoulder a little bit. So this will flare up the scapula and I can get in on the edge of the medial border of the scapula, working in through the rhomboid major, rhomboid minor, traps. And I'm going with the grain of the rhomboid.
Right here is juicy.
This is a juicy spot, right? So he said he feels this one. I'm going to tilt away a little bit, okay?
Mm-hmm.
And you can put your head back to center. I'm going to switch again back to this other hand tool. Actually, when I went to school, Grostic was on campus for a while, and we got to learn from him directly. That was kind of fun.
Where was this?
I think there's more than one Grostic, but this was John Grostic at Life Chiropractic College, where I went to. Well, they switched the name to Life University, but it's in Marietta, Georgia, and that's where I did my chiropractic training. But once in a while, we'd get a really cool kind of, ambassador to the profession that would be on campus for a semester. And it'd be great to do some of their, special workshops and stuff. I mean, all campuses are that way. You'd have a visiting professor that, if they're with a field of study that you're interested in, it's nice to, to learn from them. It's like a special treat. To learn from the horse's mouth. Mm-hmm. Another one that I learned from that was on campus, and then a couple of years, within the next decade, he died, was Dr. Webster, and he was famous for the Webster breech turning technique. So he developed or modified or worked on a technique with pregnant women when their baby is not in the vertex position for labor. He had a way without drugs or surgery to turn the baby. And turning the baby has been around for, 10,000 years, but he just had his own version of it. But it's called the Webster technique. And we get people that call the front desk from time to time to see if we know the Webster technique. And I actually got to study with him. Again, he was one of the people that were on campus for a short time, and it was fun to meet him in person and study with him. See, what's nice about this piece is it fits right in there. I know I'm just... All right. All right, you can put your arm back down. Turn your head left and right. See what that feels like?
Okay.
Good. Head back to center.
Okay.
I'm putting this on so my hands don't slip. Take a huge breath in and blow it out. Got it. And another big breath in and blow it out. So now lie on your back. And you're going to be on this part of the table here. Yep, this stuck to you. Sorry. And then come to this side. Perfect. And I'm going to reach under you and go back into that shoulder blade area. Got it. That should have been nice.
Yeah.
Good. Let's have you turn this way because your lower back is a little tight too.
Lower.
Lower right.
Yeah, it's lower right.
Yeah. So
Well, I
turn
was going to
this
say
way.
that, yeah, now I just noticed, like, as you're going through, it's like
You're feeling a little in here?
Yep, right in the lap.
Okay. So here, pick up your head.
Okay.
Like in here?
Yeah.
Yeah, so there's a little trigger point there. So I want you to pull your arm down like this and then reach it above your head again. So you're going to do like this way. So you're going to touch your hand here and reach up.
Okay.
And I'm going to get on this, okay? You should feel this.
Yeah.
And one more time. There it is. That's the spot. All right, now move it without me. Did it release a little?
Yep.
Okay, cool. So now, double your arms up like this. I'm going to pull your shoulder through so you're not right on your shoulder.
Okay.
Holding on here, pulling this knee up. Okay, that didn't pop. All right. Next thing I have you do is lie on your back.
Okay.
I'm just going to give this side a little tug. Good. And now lie on your side facing me this way. Yeah, because this is the side I think might release a little bit more. There it goes.
Yeah.
Good. So come stand up, see how you feel. You could look in the mirror and see what your back looks like. Well, you stand up over here first, and then look over your right shoulder. But here, like stand here, and you could just see. And then here, can you see it?
Oh, yeah.
And you're right, that area was a little more tender.
Yeah.
How do you feel overall?
Great.
Yeah? Okay, good.
Yeah.
All right, thanks.
All right.
Appreciate it.